So in terms of the menstrual irregularity, 90% of individuals with PCOS will have irregulation with their menstrual bleeds. So next we're going to get into our signs and symptoms of PCOS, and we're going to dive deeper into each of these. So insulin resistance can be seen in individuals that are overweight and normal weight, and we're going to talk about some of the labs that's important for insulin resistance. I've had clients multiple times being told everything's okay, and when we do the right labs, it showcases that they have metabolic syndrome or they have early insulin resistance. There can be infertility because there's not an ovulation. They are not ovulating very regularly. Hirsutism is hair growth on the face, so it's typically on the chin or on the upper lip. Alopecia is crown head hair loss. So those individuals are typically not wanting to have like a really deep part, like how my part is really deep. They're going to find if they do that, it looks really sparse on the top, or they don't want to wear their hair back because they feel like their hairline is receding. Hormonal acne is on the jawline, back, and it's often quite deep cystic. It can linger for a long time and it doesn't really come to a head. It just kind of hangs out for weeks to months and can be painful to touch. Heavy, irregular menstrual bleeds, or they can have amenorrhea, no menstruation. Acanthosos nigricans, this is where they can get darkening or velvety, kind of like a texture change to the skin. And it usually happens in the armpits and the groin or the back of the neck. It's darkening and it has a texture, coarse skin change due to androgens. Obesity is another concern, and then mood disorders, because we start to have hormones being imbalanced, and our hormones can cause lots of different types of mood. Typically, we're going to see a little bit more like lower moods come through. So in terms of the menstrual irregularity, 90% of individuals with PCOS will have irregulation with their menstrual bleeds. Infertility is 70% of individuals. Insulin resistance is 50 to 70%. Excess body hair is up to 70%. This is all individuals with PCOS.